Also, when you get a sunburn, then usually they'll refer to it, they'll chart it as erythema. You have some UV radiation that's irritating the skin, that's causing more blood flow to the skin, really to probably help you heal that sunburn. So anger, embarrassment comes and goes. If you get totally scared or super nervous, sometimes it looks like the blood drains from your head. That's actually a phrase that you might have heard in your lifetime. The blood appeared to drain from her face. And so what you're doing is vasoconstricting due to this extreme nervousness. And you get a pallor, you get a gray, ashy color to the skin. So it's not normal. Neither is embarrassment or anger. It's not a normal skin color. So it's considered abnormal skin color. Cyanosis, if you still have your big Crayola box, go to the blue section and look through. You're going to find cyan blue. Cyanosis means you are now bluish when you're supposed to be reddish. The cyanosis is due to a decrease in O2 on the red blood cell. So if all your capillaries are being perfused by blood that is not carrying enough O2, then where the blood is apparent, like at the lips, then you get a bluish tinge to your lips. And if you're not getting adequate blood flow to your fingers and toes, you might get bluish coloration of your fingers and toes. When you're all blue, you're really in a lot of trouble because you're generalized decrease in O2 saturation. So cold can cause cyanosis, nervousness can cause cyanosis in your fingers. Usually extreme cold is causing it. And then also cyanide is going to produce cyanosis. Bronzing, you might think, oh, well, that's just a tan, but it's not. It's a very abnormal brown color. And you'll recognize it as not normal. It's very heavy in the browns and kind of yellows too. It doesn't look like the rest of the body, and usually it's in patches over the surface of the body, maybe more on the arms and legs and less on the torso. It's often at times a sign of some medication that the individual is on. Some people on arthritis medications will get this bronzing, and they're usually on I want to say tannins, but you don't know what that is. But when tissues invade the joint capsule and destroy the joint surfaces, they're actually the tissue from the joint capsule that's doing that. We put them on drugs that slow down the replication of those cells. And one of the side effects is this bronzing of the skin. Also, we'll talk more about it later, but Addison's disease, one of the signs of Addison's disease is that the skin bronzes. And this is despite them being out of UV exposure. Addison's disease, you've got a glucocorticoid deficiency and also a mineralocorticoid deficiency. When the skin turns yellow, if you've already got yellow tinges to your skin, jaundice may not be apparent in the skin, but you look at the whites of the eye and it will be apparent there because the yellowness in the blood vessels will stand out in the whites of your eye before it will stand out in the skin that already has keratin in it. The jaundice is not due to keratin, it's due to the breakdown of the hemoglobin molecule and the fact that the liver is not able to get rid of it. So it's a sign of liver disease. The liver is not clearing the byproduct of hemoglobin breakdown, and so it's building up in the body. Also appears in babies. If you have a baby and a baby in utero was getting oxygen from mom's placenta, so mom inhales, sends O2 out to the placenta, the oxygen diffuses across to the baby's blood. The baby's got to lock onto that oxygen because it's not getting very much oxygen there. Wants to make sure it gets to its tissues. And so it has a different type of hemoglobin. It has a fetal hemoglobin that will bind O2 very tightly. We'll still leave it, it will still give it to the tissues, but it doesn't want to lose it along the way transporting. So it binds the hemoglobin because it's in a low, it has the fetal hemoglobin because it's in a low oxygen environment in the uterus. But after birth, it's out here in relatively O2 rich air. It doesn't need that hemoglobin anymore. So the red blood cells are going to be reproduced, and you're going to make the adult form of hemoglobin. And you're going to start getting rid of the red blood cells that have fetal hemoglobin at a very high rate. So babies will become jaundiced, and moms will freak out, why is my baby yellow? And I was just talking yesterday to a mom, and she was saying the doctor told her to put the baby out in the sunshine, and then that would clear up the jaundice. And I was thinking, what's that idiot doctor? But I didn't say that, but I was thinking it. And I said, I think that would be a bad idea because the lifespan of a red blood cell is 120 days, so in 3 months the baby's going to not be jaundiced anymore anyway. You expose them to UV radiation too early, all you do is hasten the damage to the skin. And she says, well, that was 15 years ago. I go, oh yeah, well yeah, 15 years ago they didn't know about all this skin cancer stuff, and they didn't realize, they were making recommendations. And if you knew where she went to get this doctor, you'd kind of understand that sometimes the doctors there are not so good. As they can't be fired, so you can probably figure out where that hospital was. Anyway, if you have a jaundiced baby, have it checked out. If the pediatrician says put the baby in the sunlight, you say, thank you, doctor, and then don't do it. Because in 3 months, the baby's going to be jaundiced anyway. If the jaundice doesn't go away in 3 months, having the baby in the sunlight is not going to help because you got liver problems. So anyway, it's probably not liver problems there, but adults who get jaundice, it's a sign of liver problems. Albinism, you've heard of albinos, and I think there's been some albinos in movies that you probably come in contact with. Albinism is where you genetically lack the ability to form melanocytes. Melanin in your melanocytes. You have melanocytes, but they can't form melanin. So the skin is white, really, 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 really pale. And also the hair is platinum blonde, it's really, really white. And you look at the irises of the eyes, there's no melanin there, or very little melanin there, and the eyes are super light blue. These people very rarely go out in the sun unless they have a hat on and big, thick, dark glasses and shirt and gloves, and everything is covered up. They're extremely photosensitive. You probably all had a hematoma. Hema meaning blood, toma meaning swelling. You whack yourself with a hammer, you run into something, and you burst capillaries under the skin, they bleed underneath the epidermis, and you get what's called a blood blister. That's a hematoma. So you just wait, and the macrophages come in and clean it out, and then it will disappear. So here's your melanocyte. It's producing granules of melanin. It has these cell processes that go up into the more superficial layers of the epidermis. And then the keratinocytes chomp on these cell processes. They actually send their little pseudopods out, engulf part of a melanocyte, and pinch the cell membrane of the melanocyte off, and then endocytose, this plasma membrane full of the pigment into themselves. So here, the keratinocyte is pinching off part of the cell process. Here is one of those vesicles that's already inside the keratinocyte. That will get condensed, and then you'll be left with a pigment granule in the keratinocyte. So here is another one that's been pinched off already. Here's a keratinocyte phagocytosing the melanin. This process is referred to as cytokine secretion, implying that the melanocyte is secreting the melanin into the keratinocyte, but that's actually not what's happening. The keratinocyte is actually phagocytosing the cell processes of the melanocyte. So it's probably called cytokine secretion before they realized that it was a phagocytosis process. So melanocyte produces the pigment, but it has to get transferred to the keratinocyte. And there's many, many more keratinocytes than melanocytes. So those are the ones that, if they get the melanin into them, those are the ones that can help with protection from UV exposure. So body will be right at the basement membrane, and then all these processes, if you look carefully, they're not coming out through the basal lamina. They're going under, right next to the basal lamina, and then projecting up. So you gotta look closely at the edges here. So they're projecting up into the upper layers of stratum spinosum. Langer's lines. Be very careful reading old textbooks. They used to, if you're going to medical school and you're going to be given a cadaver to dissect, if you follow Langer's lines, you will be correct, and you will be cutting with the collagen bundles and not across collagen bundles if you follow those lines. They used to say that surgeons should follow these lines until they started doing research on alive people versus cadavers. Langer worked on cadavers, so these collagen bundles and how collagen aligns in dead tissue is different than how it aligns in live tissue. So probably at some point, some surgeons were getting really frustrated because they were taught in medical school that if you cut with Langer's lines, you could suture the tissues back together and you wouldn't get a nasty looking scar. And then they did it and they found they had a nasty looking scar. So what was wrong? Was my technique wrong? And then they started looking at live tissue and they found, well, the collagen bundles don't follow those lines. So they're actually coming out with surgical lines, which are quite different than Langer's lines. So anyways, collagen runs in bundles, you know that, or you should know that. If you apply forces to the collagen, they will be even more aligned in the tissue. But you can see that in areas where there's a lot of flexibility, a lot of stretching going on, then they run in multiple layers. If you get a cut in these hypermobile regions, you get a laceration in those areas. When it heals and you start to move it again, the healing of the wound, because it was a laceration, meaning it was jagged edges, you don't get the collagen bundles realigned unless you go to a plastic surgeon who really knows how to realign those. You get a keloiding scar because you're stretching those areas anyway, and the collagen bundles weren't aligned, so now they're forming a nasty, big, puffy looking, gnarly looking, red, purple scar. And the keloiding, again, if it's usually benign, but if it interferes with joint function, you can get that scar removed. You go to a good dermatologist, you go to a good plastic surgeon, they can excise, they'll cut the scar out and put the bundles back together in the proper alignment. Okay, dermal components. a lot of sensory receptors. How you know your environment, you experience your environment, is mostly through the skin. Another way is your mouth. You find the babies sticking things in their mouth a lot. They're very sensitive, tongue and lips, and they can feel objects better there because there's more sensitivity here, and they're not fully myelinated out in their hands. That's why they're not coordinated yet. But also sensory nerves are not fully myelinated, so less sensitivity here. So you're going to find objects getting into the mouths of babies because that's where they can experience the nuances of the object better. Of course, it's dangerous, so you want to discourage it, but you have to realize that that's the way the baby's experiencing its environment until its hands get better. Okay, a lot of blood vessels, they form networks. That's what plexus means. It means a network. You'll have the sensory receptors that we already covered, the touch, pressure, pain, vibration, and temperature receptors there. Subcutaneous, just to remind you, it is also known as, AKA means also known as. I had a student come up to me and said, "What's ACA?" And I was like, "What do you mean, what's ACA?" I had to think, and he says, "Well, you had it there, capital AKA," and I said, "Oh, that's short for also known as." I didn't realize people didn't know that. So I'm just telling you in case you don't know, AKA means also known as. Other names for the subcutaneous layer are hypodermis and also superficial fascia. The job of the hypodermis is to stabilize the dermis, keep the skin in its position. You look at older people, the skin is not in the position it is in younger people. It's hanging down, even if their muscles are fully flexed. You hit that and the tong, tong, tong is going back and forth. They've lost that superficial fascia. They have also lost muscle mass. And the consistency of the dermis has changed as well. But when you lose the superficial fat, you then lose the stability, or not the most superficial fat is your hypodermis. When you lose that, then the dermis isn't held in place. So you go in there with a liposuction tool. Have you ever seen that? It looks like a vacuum cleaner hose, and then you ram it back and forth, in and out, and the fat is sucked out. When they finish that, you've got these ropes of skin. What do you do with it? Well, you got to excise it and remove it because it's excess baggage. People who just lose a humongous amount of weight, they also will have skin hanging on what's left of their body. So these biggest loser guys, they'll oftentimes lose weight so fast that the skin can't remodel, and so it's just hanging loose, dead weight tissue. You can remove it, but if you gain the weight back, then you're in big trouble. Okay, so if you look at your skin, you can pick it up and you can move it away from the underlying muscle. That's because of this hypodermis. You can actually pinch and move the skin and the fat away from the underlying muscle. If you want to test for the fat percentage of an individual, probably the best way, if you know how to do it, is skin caliper method. And that's pretty much what they do: grab, pinch away, and then measure the amount of fat in the dermis. So hair, this is an accessory organ. It is going to develop from cells that have invaginated. We learned about glands, and we have they are formed from epidermis that invaginated. The hair shaft is also consisting of cells that have invaginated from the epidermis. Down below, the cells will differentiate into hair forming itself. And the hair will grow from the root up, and it will be alive, it will be connected to the root shaft until it gets to the level of the sebaceous gland. At that point, then the internal root sheath is no longer there, and you just have the external root sheath. When you pull hair out, or when it falls out by itself, it's going to be because the dead hair part is now what's snapping off. You pull hard enough and you get some yellowy looking stuff at the end of the hair that came out of the scalp. Then you've probably pulled out some of the internal root sheath. And if you pull hard enough, you might even get a bulby looking end, and then you've got maybe the root of the hair. The hair doesn't grow back. You've destroyed the hair root. The hair grows back. You probably just damaged the internal root sheath, and that will be replaced by the cells that are surrounding it. Of all the hairs on your body, 98% of the 5 million hairs on your body are not on your head. You think that's the hair is part of your body, but there are different types of hair. You look at the face, you got tiny little hairs you call peach fuzz. That's over the surfaces where you don't see hair. You look closely, you have the little itty bitty hairs there. And here you have little itty bitty hairs all over the rest of your body, probably with the exception of areas that are very flexible. But maybe even in there you see some hairs. You have your eyelashes, you have your eyebrows. Those are also hairs. The hair, I'm going to skip this slide. You can look at it, but more information is actually on this slide. The center of your hair, like the center of any organ, that has different structures, external than it has internal. The internal will be called medulla, and the external will be called cortex. The medulla is kind of chamber-like. You'll find a lot of melanin in the medulla, and some of it also out into the cortex, but the majority of the hair color is going to be in the medulla. When you get gray hairs, you're not producing the melanin anymore, and the center of your hair is full of air. So you have a gray color to the hair. So cortex, and then right on the surface of the hair is your cuticle. Cuticles can be nice and flat, and then you have straight hair. Or they can be nobody with really curly hair. But if you see somebody with really curly, kinky hair, this is kind of wavy, yours is kind of wavy. I don't see anybody with really curly hair. Maybe it's all pulled back in a bun. There's some curly hair back there. Wavy hair anyway. The wavier your hair is, the more oval the shape of the hair is, and a little bit rougher on the cuticle. You have really curly hair, the cuticle is rather roughened up. The whole principle behind a permanent wave is you take the hair and you wind it around a rod, and then you dump chemicals on it to roughen up the cuticle. You wait a while, and then you neutralize the chemical. And after you wait a while again, you take the hair off the rod, and it's permanently coiled by the shape of that processing. And then that roughened hair then takes on other manipulation that are like setting it and curling it in other styles. If you take somebody with perfectly straight hair, get a hair from them, ask them first, don't just go up and yank it out. And you take the hair from the growth end and you put it between your fingernails and pull back towards the root end of the hair. You roughen up the cuticle, and hair that's that long will then coil up into this little spring-like thing that may be about that long. So you're just roughening up the cuticle as you go backwards. I used to see students who'd sit there in class, and they'd be doing that. Spring. Why don't you pay attention to lectures? That's not going to help you with an exam. Anyway, okay, so cuticle, if it's rougher, you get a curlier hair. From the cuticle, the next layer out is your internal root sheath. And that's going to connect the hair to the epidermal-like cells of the external root sheath that are the invaginating cells all the way down. And then you get this kind of amorphous layer of secreted fibers and matrix that don't have cells, just this kind of amorphous mass. And when you look at it, it's giving you a glassy appearance. So you notice it's got the same descriptive term as your stratum lucidum. It's not, there's no organelles there. It's just stuff. And it's connective tissue fibers and some of the gelatinous mass. And then you have your connective tissue that will anchor the hair to other structures around there. Most hairs will have sebaceous glands associated with the hair shaft. The hair is alive, considered alive up to the level of the sebaceous gland, and then it detaches from the internal root sheath and it's dead from that point up. Sebaceous glands are there when an erector pili muscle is stimulated to contract. This is under autonomic nervous system control. So when you get scared, your hair stands on end. When it's cold, your hair stands on end. When cold, the hair stands on end to try and trap warm air against your body. Doesn't do it very efficiently if you don't have much hair on your body. But as that muscle contracts, it's going to pull down on the epidermis about in that region. And the hair will go more vertically because it's pulling the base of the hair shaft over. And you'll squeeze the sebaceous gland. So secretions will come out in the sebaceous gland. If you rub your hair, you brush your hair, you distort the scalp with the brushing, then more secretions come out in the sebaceous gland, and that's to help to keep the hair more pliable and also give it a coating. So if you have curlier hair, the more you brush it without creating static electricity, the smoother the hair will get.
When you try to train your hair with braiding hairstyles, like if I want to change my part and then keep going, never mind.
I'm not aware that sebaceous glands have
like
anything
your
to do
hair
with your...
moves, because you're moving your hair to, I don't know, I need to start to ask.
Okay, we can think about that after class. Okay, I'm not aware that sebaceous glands have anything to do. It's the direction of the hair shaft and how you place it for long periods of time, whether the part stays or not. And giri, local people know what giri is. What do they call it on the mainland? Cowlicks, that you look like a cowlick back of your head, and you've got hairs that go in a coil, kind of whirling around. That is just that the orientation of your hair shafts are different. So they tend to line up in one direction and then maybe go around in another direction.
When I put my hair up, that like really even worse when I take my hair down. So that's what I'm asking you, like, is that
I don't think it has to do. I don't think it has to do with the sebaceous gland, but it has to do with the distortion of the hair shaft. And Okay, we go on. This is just a longitudinal section through the hair. And so you see the medulla, and then the next layer out is the cuticle, and then the next layer out is the internal root sheath, then external root sheath, and then you'll get the glassy layer, connective tissue. And I'm assuming that, as it says here, this is supposed to all be adipose. It's a very strange subcutaneous layer of fat that goes that far up. Normally hair, if you look back at the skin, doesn't show hair. The hair shaft and the secretory parts of the sweat gland, they're right at the deep border between dermis and hypodermis. This is very advantageous should you get burned, not a full thickness burn down to the muscle, but just a superficial burn, like a 2nd degree burn through the epidermis. You get healing because where did the hair shaft come from in the first place? Epidermis. So you've got all the stem cells that can migrate up and help to heal the epidermis. Sweat gland, the stem cells also can migrate and help to replace the epidermis. But if you have a full thickness burn, you've lost the hair, you've lost the epidermis, you've lost the hair shafts, you've lost the sweat glands, and it takes a long time to heal those. You have to either culture the epidermal cells and then replace them, or you have to graft skin. So having the intact hair shaft, sweat glands, it actually helps with the healing process for burn. So the root of the hair, you can look back, I'm not going to go back there, but the root of the hair has sensory nerves on it. When you tug on somebody's hair, it hurts. And the nerves surround the base, and they're actually so sensitive. If somebody comes up behind you and just blows on your hair, you're probably going to go like that because you think that some bug has landed on your hair and just kind of creeps you out, and they're probably back there laughing. But if a bug does land on your hair, and just lands, a little gnat just lands on one hair, you're already doing that because your hair is that sensitive to the distortion. The erector pili or piloerector muscle, that's another name for the same thing. Its job is to get the hair more vertical, to trap warm air against your body. And that works fine for dogs and cats, and it works good for chickens and birds. They do this horriculation, and they can fluff up the fur or fluff up the feathers, and then the body heat is trapped against the body, and they're warmer. But our hair stands on end, yeah, but it's not trapping any warm air against our body. Up here it does a little bit if you still got your hair. Okay, 3 types of hair. I think we can cover this in the last 5 minutes. We've got vellus hair, that's our peach fuzz. And then we've got terminal hairs and intermediate hairs. Terminal hairs are what we have on our head. And we'll talk mostly about that. So if you look down at the bottom, male pattern baldness. Don't see any male pattern baldness in the room. And maybe you inherit that tendency. So if your dad and your grandpa got receding hairlines, or they got bald all the way around the top, or they got bald patches in the back, that's what's referred to as male pattern baldness. And the terminal hair disappears. It's not the scalp is not bald. They call it bald, but if you look very closely, you see the peach fuzz that's on the face is now up on the top of the head. So the terminal hair is now replaced by a vellus hair. So if you're brave enough or you know somebody well enough who's balding or bald, go up and look at the surface of their head and you'll see this little peach fuzz up there. So they're not totally bald. Okay, so hair, you're going to shed hair all the time. Depending on how anal you are, you're going to get creeped out by this, or you're just going to ignore it and clean it up and throw it in the trash. So hair goes through cycles. Anagen is when the hair is actively growing. And this is going to vary with the hair type. It's also going to vary a little bit. You see that the anagen can be 2 to 5 years in length. So there's a large normal variation in how long the hair will actually grow before it goes into a quiescent phase, and then the hair will not be growing anymore, and you'll have it grow. It will continue to move up the hair shaft. When it reaches a level of the sebaceous gland, it will either just fall out by itself, or when you're brushing your hair, combing your hair, or blow drying it, it will just fall out on the cabinet. So you're not going bald with that. Normally, you lose about 40 to 50 hairs per day. And so if you're really anal, you will blow dry your hair over the sink, and then you will count every hair in the sink. If you have 40 or 50 hairs in the sink, that's normal. If you find you have 100 hairs in the sink, then start thinking that something is abnormal in your life. School is abnormal in your life. The stress of exams, the stress of studying, and other things that are stressing you will cause you to lose about 100 hairs a day. So you look at poor diet, you look at, did you just have a high fever? Are you stressed out? Yeah, school and exams, and then pregnant women tend to lose hair faster. If you've had cancer and you've been treated with radiation, the hair falls out. Interesting thing there is it usually comes back much curlier than when it left. So something with the cancer treatment is changing the way the hair cuticle is. And then if you have come in contact with old houses, you're stripping paint in an old house, or you're pulling up linoleum in an old house, you may have come in contact with heavy metals like lead, and that will cause your hair to fall out. So you need to get those kinds of things checked out. Okay, so hairs will fall out in this quiescent phase. The atrophying phase go through that pretty quickly. The bottom's not producing new hair, so what's going up is then just going to reach the point where the hair falls out. You'll have a blank hair follicle until the new anagen phase starts. So how long you spend in telogen, which is this quiescent phase, about a month or 3 months, and then the hair will start to grow again, and eventually it will come out that follicle again. Okay, so next we'll talk about functions of hair.